Welcome, my name is Peter Strong and I'm a professional psychotherapist, and I specialize in online therapy that I provide over Skype for the treatment of anxiety and depression and other emotional problems without the use of medications. This is not a medical treatment. This is a form of psychotherapy called mindfulness therapy that I have developed over the years and found to be particularly effective for anxiety and depression. So I'm often asked, is online therapy as effective as in-person therapy? And the answer is yes, it is, most certainly. For the vast majority of people, online therapy is just as effective as therapy in person. Especially if you use Skype or similar video platforms so you can see each other. That's the key ingredient. You must be able to see each other to really have a good communication, which is so important for effective psychotherapy. So if you can see each other, then in my opinion, there is no appreciable difference between online therapy and therapy in the therapist's office. Now, online therapy does offer some advantages. Clearly, it's more convenient for you, the client, because it means you can conduct your therapy sessions from home or from work or even in your car. All you need is a quiet place and a good internet reception, and then you can conduct online therapy. So people like the convenience, and for people living in remote areas, or for people living abroad, if you are based in a foreign country, you may not have access to the right kind of psychotherapist. And so online therapy gives you greater options for getting the kind of help that you are looking for managing emotional problems such as anxiety or depression or addiction. A lot of people like the greater privacy offered by online therapy. You don't have to wait in a therapist's office or a similar public environment like that. You can conduct your sessions in the privacy of your own home, and that's a big factor, especially if you're struggling with a difficult set of emotions that you might be experiencing, such as with depression or with addiction. So that greater level of privacy from your point of view is often just what we're looking for. The other advantage of online therapy is that it's more comfortable for you as well. It's much less intimidating than the more typical clinical-based therapy that's offered in a psychotherapist's office setting. And from my point of view, my philosophy is that we want to make psychotherapy as comfortable as possible. It should not be clinical in nature. I personally do not advocate a medical approach for treating anxiety or depression. Medications may have some value in controlling symptoms, but medications will do very little indeed to change the underlying cause of your anxiety or depression or addiction. And that requires the right kind of psychological help, working with the underlying habits that cause your anxiety or depression or other emotional problem. So the style of psychotherapy that I specialize in and find works best for the vast majority of people online is mindfulness therapy. This is a particular system of psychotherapy that I've developed over the last 10 years or more that really focuses on working with those underlying habits which are primarily based around habitual reactive thinking. Now, thoughts do not create anxiety or depression, as is often thought. It's not the thoughts themselves that create anxiety or depression. It's the way that we become identified with those thoughts or beliefs. It's the way that we become trapped in that stream of negative reactive thinking. That's the problem. And this I call reactive identification. And that's a big part of mindfulness therapy, is learning how to disidentify from thoughts, beliefs, and memories as well. Also, working with emotions, we need to build a relationship with those emotions that helps them heal. And if you identify with the emotions and become overwhelmed by your anxiety or depression, that will prevent healing. So that's another reason why we focus on developing a mindfulness-based relationship that's not reactive with your emotions, because that is what is the most essential component for healing. So anxiety and depression are habits. It's better to think of them as learned, conditioned habits rather than a disorder or some sort of medical illness. That may apply in a very, very small number of cases, but generally for the vast majority of people, their anxiety and depression are best thought of as habits. They are learned habits. We're not born with anxiety or depression. We acquire these habits through time and often through the trying to cope with emotional trauma in childhood. It's very common. That's a common starting point for the anxiety habit or the depression habit. Addiction, it often flows from that underlying anxiety or depression. So we work on these habits very, very systematically in a focused way. We learn to disidentify from the reactive thoughts. We learn to establish a healing relationship with the emotions based on compassion, which is a very important part of mindfulness teaching in general. And people see results quite quickly when we take this kind of strategic mindfulness-based approach. So generally I tell all my prospective clients, you should expect to see change in the first 3 or 4 sessions. You should expect to see significant improvements. I do not support this concept of open-ended psychotherapy which can go on for months or years even, where you're simply talking about your problems. Talk therapy, just talking about your problems, is seldom enough to change those underlying habits. So mindfulness therapy focuses on changing the cause, the underlying habits, and is quite different than conventional talk therapy or counseling that you may have experienced in the past. So if you'd like to learn more about Skype counseling therapy for anxiety or depression, if you would like to start sessions with me, then reach out to me by email. Simply contact me through my website and we can schedule a Skype counseling session at a time that works for you. I see people throughout the USA, Canada, a few in Mexico, and certainly lots of people in Western Europe, the UK, and as far away as Australia and Japan. All you need is an internet connection and a willingness to learn how to change these emotional habits that cause so much suffering in our lives. So if you're motivated and you want to change, then please reach out to me by email and let's schedule a session. You will see changes even after that very first session. I will start to teach you the mindfulness-based techniques that are so effective for healing anxiety and depression, and for working with addiction too. So please contact me and let's get started. Thank you.